If you're waiting on a doctor to approve your morphine at 2 a.m., we've already failed that patient. Comfort in hospice is not a luxury. It's the core mission. And if you don't know how to use an e-kit, you're not practicing hospice. You're practicing hesitation. Hi, my name is Donnakay. I've been an RN for 12 years. I'm currently serving in a role as a hospice admission nurse, and I've also worked as a RN case manager. I would love to share with you some of my tips and tricks on how to shine as a hospice nurse in order for us to provide better patient care and to help these families in their most hardest time. Watching a loved one die, may it be family, a friend, a neighbor, it doesn't matter. It hits home and it hurts. So if we can come in and help and be a beacon of light for them, I would love to help you do that. Today we'll be discussing the e-kit. If you don't know what an e-kit is, it's the emergency kit that every single hospice patient needs to have. Every symptom is a fire, and the e-kit is your extinguisher. Your e-kit is your emergency room in a box. Not just a nurse, you're a responder. The e-kit turns panic into peace. And the e-kit isn't just a backup, it's your front line. While people are dying, it's not like TV. While people are actively transitioning, it's not like TV. They don't wake up, they don't say something profound and then close their eyes and go on to glory. It's an ugly sight. To watch your family member pass is not pretty. They have the death rattle, they're breathing 40, 50 times an hour, their temperature is through the roof, in which we call a terminal temp. They're most likely having pain, they're agitated. We can't just watch this. We have to provide families with what they need at the time that they need it, actually, before they even need it. It's always prudent to check the e-kit on every visit, because if you don't have an e-kit, you don't have a plan. So, because this is a general video, I'm gonna go over the general medications that are in an e-kit. First and foremost, morphine. Either morphine or hydromorphone. It depends on how it reacts to the patient. Most patients, if they're allergic to morphine, they can take hydromorphone. Don't ask me the math or science about it, it just works. It's what I've seen in my practice, but if you've seen something else, please share. I don't know everything, and the people who are watching my video wants to know, if not this, then what? And you can provide that for them. Morphine is liquid gold for pain and breathlessness. Morphine is usually ordered for two things: shortness of breath and pain. It's effective and it's fast and it's essential. Anxiety at the end of life isn't just emotional, it's physical. It's draining, it's tormenting, not only to the patient, but also to the family watching. Ensure that Ativan or lorazepam is on board. Make sure you check your e-kit when they arrive on your first follow-up visit, or as your primary nurse is visiting, you want to ensure that this is there. I'm an admission nurse, so I reach out to my nurses and they can see what I've ordered. As a primary nurse, it is your responsibility, if you did not do the admission, on the next visit to ensure that you check the e-kit so that when symptoms do arrive, you're not just realizing that the lorazepam wasn't in the e-kit. It wasn't sent out, or it's still pending the doctor to sign the prescription. You want to ensure that everything that you ordered for that e-kit is in there. Treating a symptom and not having your medications is a failure on your part. I'm saying this with love because it happened to me. I'm saying this with love. Lorazepam or Ativan calms the storm. It helps with nausea, it helps with agitation, and it also helps with insomnia. One med, 3 battles. Use it. Donnakay.Simone or Levsin, the silent hero. Family listening to their family members or their loved ones drowning in their own secretions, it's really hard to hear and to witness. So, provide your Levsin under the tongue, in the gums, in the cheeks. It dissolves and it helps your patient not to drown in their own secretions. It dries the secretions, it calms the muscles, and it allows smooth transition to happen. It's a blessing to be able to provide this for patients. Don't ever forget this. Terminal agitation isn't just restlessness, it's torture. For real, it's torture to watch. Nausea steals comfort. Vomiting steals dignity. What is the core tenets of hospice? Comfort and dignity. Every single decision that we make in hospice, that is the undergirding of it. Every decision that we make. If the result of the decision is not leading to one or two or meeting both of those outcomes, we're not doing it. This is hospice. This is end-of-life care. This is why we use medications like compazine or promethazine, because at the end of life, nausea is prevalent and it's pretty normal to have, and this is why we have these medications. Constipation isn't just uncomfortable, it's cruel. So along in that e-kit, we have Dolac suppositories, Senna, and Fleet enemas. Yes, I just gave a patient an enema like 2 weeks ago, and he cleared the room. I was so surprised that a little person like that could hold that much in, but I felt such joy helping my patient, and seeing the relief on his family member's face once he passed the stool made me so happy. Yeah, the room was funky, but we were all smiling from ear to ear. That's what hospice is. You find joy in the little things, or the big things. When the body burns out, Tylenol cools the flame. Acetaminophen suppositories are usually in your e-kits because terminal temperatures are a real thing. Sometimes the patient's temp will be elevated, sometimes it's not, but their body is hot. You can feel it when you touch them. In hospice, we don't treat numbers, we treat symptoms, we treat patients. I left off haloperidol because research is showing that most companies are moving towards taking it out of their e-kits because of some of the side effects of this medication. But if your hospice uses haloperidol, speak to your clinical nurse manager or just look up what it's used for. My goal in these videos is to help you become a better hospice nurse, because I know that as a nurse advocate, if I support you, I don't have to worry about the patients. It goes without saying I love patients, so loving you will help me love more patients.